we are we're being recorded now, so we're going to call this meeting to order. This is our final budget hearing, I believe, and we have some discussion, I think, planned after this, but this is going to be the Division of Health and Human Services budget hearing, and I'd like to welcome Tim Kaufman, our Director of Health and Human Services. Thank you for being here.
Good morning, Commissioners. Thank you. The mission of the Division of Health and Human Services is to promote health and wellness, independence, and improved functioning for individuals served. We do that through 4 departments, 5 budgets, 6, 7 budgets. There's a director's office budget, COMCARE, the Developmental Disability Organization, the Department on Aging, and the Health Department. And then I'm also going to talk about the Crime Prevention Fund budget and the housing budget, which used to be an independent freestanding department, which has now been rolled into our aging department. With me today, I've got department heads, Marilyn Cook, Dee Stout, Annette Graham, and Adrienne Byrne-Lutz. So they'll answer any of the hard questions. We're going to begin on page 312 with the Director's Office budget. The Director's Office provides oversight and direction to the division and looks for efficiency opportunities through consolidation and a coordination of efforts among the departments in the division. We also serve as an interface to the social service provider community and work with a number of different community partners, and we monitor one significant contract with a community partner, the Child Advocacy Center. These functions are performed by internal staff. The Housing First program is a very successful partnership with the City of Wichita to move chronically homeless individuals from homelessness into housing. And the goal there is to get them to resolve that housing issue first, and that gives them an opportunity to then work on any other issues that they may have that could have led them to homelessness. There are 64 units that we manage, and the costs are split between the city and the county. And the case management is provided by partner agencies that refer to us for placement. And these services are provided by internal staff and then existing partner agents, or external partner agencies. You're all familiar with the Child Advocacy Center. We've talked about it a couple of different times throughout budget hearings. And as you know, the Child Advocacy Center is the umbrella agency that deals with child abuse, neglect investigations, and they're about to have their grand opening at their new location. We have a funding agreement with them that we manage, and in 2015, there were 1,800 children that were served by the Child Advocacy Center. Last in the division director's budget is the Shelter Plus Care program. In this program, the division partners with COMCARE, Miracles, and Positive Directions as referring agencies to provide tenant-based rental assistance or housing vouchers. Homeless individuals that are experiencing severe and persistent mental illness, substance use disorders, or HIV/AIDS, and their families are eligible for this program. And this program does require participation in services to be eligible for the housing voucher. Average length of stay for this particular program is 2 years, and again, this is provided by internal staff along with external partner organizations. So the way the money flows into the director's office in terms of property tax funds, those funds go to the director's office, Housing First, and the Child Advocacy Center, and non-tax funds go primarily to Shelter Plus Care for those housing vouchers. There's the breakdown by fund, and then you'll see by expenditure. Relatively flat budget. The 16% increase represents $500 in commodities, and the rest is going to be tied to personnel costs. As we move through the budget book, page 319, you'll find COMCARE. COMCARE's mission is to help people with mental health and substance use needs to improve the quality of their lives. And there are a number of programs that make that happen, including administration operations, addiction treatment services, Center City, crisis services, community support services, children's services, and then outpatient services. Administration and operations provides the infrastructure that allows for the service providers to deliver those services in the community. And in 2015, the billing staff collected $22.9 million for COMCARE services. We also do the billing for EMS services and collected $13.9 million for those services. And our MedRecords staff processed almost 10,000 different MedRecords requests. These services are provided by internal staff. The addiction treatment program is designed to deliver services to individuals that struggle with alcohol and other drug use and addiction. There were 1,300 people served last year. Services include individual and group therapy, and they're designed to initiate and maintain sobriety and a drug-free lifestyle. Staff provide these services at the addiction treatment program and through the municipal and district drug court programs, and those services are provided by internal staff. Center City is a program designed to provide mental health outreach to individuals that are homeless, and in 2015, 284 individuals were outreached, 214 individuals were enrolled in services, and the program also manages 19 apartments that are designed for individuals experiencing severe and persistent mental illness. And these services are provided by internal staff. The crisis program begins on page 342. It is an emergency mental health service, available 24 hours a day, 365 days a year, to all residents of Sedgwick County and anyone who may be passing through. In 2015, there were over 5,500 interpersonal face-to-face services delivered. More than 1,000 individuals received services at our residential scope and crisis stabilization unit. Over 3,600 people were intaked into the COMCARE system, and almost 68,000 calls were received through the hotline. These services are delivered in person, by telephone. We've got a mobile crisis unit that is able to go out into the community. And later on in the efficiencies area, I'm going to talk about some new technology that we're also using for crisis services. These services are delivered by internal staff. Our community support services program is one that is designed to deliver what are known as rehab services to those individuals experiencing a severe and persistent mental illness. And so those are the folks that are most impacted by their mental illness. And it helps them maintain in the community rather than at a higher level of support and service like a hospital. In 2015, we had 1,300 individuals receive services at our CSS program. 100 people were also served in a new supported employment program where we worked with individuals who are experiencing a severe and persistent mental illness and helping them find competitive employment. And these services are provided both by COMCARE internal staff and then contracted community partners. Our Children's Services program serves individuals up to the age of 21 who have a severe emotional disturbance and they're at risk at hospitalization. And these children receive medical, therapy, and case management services. We served 2,500 kids in 2015. 44 children were served through the therapeutic preschool program that we have, and these services are provided by internal services and also through contracts with community partners. COMCARE's outpatient service is our largest individual program, served almost 5,300 individuals last year, individual and group therapy and medication management for adults with a variety of and a varying level of mental health issues. And we provide symptom relief to people so that they can function in the community in a normal day-to-day life. And these services are provided by internal staff. So when you look at how the money flows into COMCARE, the money coming from the property tax funds goes to admin operations, the addiction treatment services program, crisis intervention services, and to the outpatient program. And then non-tax funds go also to support admin and operations, the addiction treatment program, Center City, crisis intervention services, community support services, the children's program, and our outpatient services. So the summary by fund, you see that in 2016 we had a budget request of $41,591,713, and our 2017 request is for $40,663,538. So that's a reduction of about 2%, and the bulk of that reduction comes in the COMCARE grant fund, tied to a couple of different things that are going on. One is that care is being managed more tightly by the managed care organizations that run the CanCare program, and we made some decisions in terms of reducing expenditures to fit within the budget that was available, and so there's a slight decrease there. And then when you look at it on the expenditure side, you can see that those reductions were made both in contractuals and commodities for a total $40 million request. If we move to page 368 in the budget book, we'll find the CDDO, and their mission is to assist people with developmental disabilities to receive quality services and achieve greater independence. And they do that through an operations subsidized living program, their service access and outreach program, quality assurance, state aid, their administration and finance function, and then a capacity development program that they've instituted. The subsidized living program serves 610 adults, and the goal of that funding is to assure that there's timely access available for residential and day supports for individuals, and the money for that particular program right now goes to Arrowhead West, Ketch, Starkey, and ResCare, and the services are provided by community partners. The service access and outreach function within the CDDO is the single point of entry into the service system, and that they do that through a screening mechanism. They determine eligibility, and then they provide information and make referrals to individuals and families so that they can select the community service provider of their choice. 2,564 individuals are currently eligible for IDDD services in Sedgwick County. These services, the service access and outreach services, are provided by internal staff. Much of the work that's done in the division is done on behalf of state agencies, either KDHE or KDADS, and quality assurance in the CDDO is a good example of that. They provide oversight and monitoring to the local provider network here on behalf of the state. Their quality assurance happens through site visits, record reviews, and traditional contract monitoring. And there are 47 different affiliated community service providers that are their compliance is assured through our quality assurance program. Those services are provided by internal staff. State aid funding is used to fill gaps in the service system, and the services that can be funded through that include transportation, some children's services, non-Medicaid eligible case management, and then some flex funds. And the CDDO coordinates with stakeholders to make sure that those funds are allocated in such a way that they're going to have the biggest impact on individuals. And again, the services provided by internal staff to allocate those funds to contracted providers. Like the other departments, there's an administration and finance function within the CDDO, and those services are provided by internal staff. Page 375, you'll see a budget for the Capacity Development Program, and that's a program that was implemented a couple years ago to make sure that there was system capacity in the community. There's been a lot of talk over the last few years about the state making efforts to move people from the waiting list into services, and we wanted to make sure that as those additional individuals were introduced into the service system, that that we had services available for them. So Dee worked a deal with some partners where she provides matching funds on a 60-40 split to allow them to either expand their capacity, introduce new services, and it's been very successful so far. But as you can see, there are 1,200 folks that are on some type of a waiting list, either the underserved or the unserved, and so we want to make sure that as those folks are funded at state level, we've got capacity within the community to serve them. Property tax funds go to the operations program, the $2.4 million. The non-tax funds fund the service access and outreach program, quality assurance, the state aid function that I described, administration and finance, and then capacity development. And so you can see by fund the request, the general fund request is flat, and there's a slight increase in the grant fund, and by expenditure we've got some personnel increases, and that's where your request totals. The aging department in your budget book starts on page 376, and its mission is to assist seniors, caregivers, and individuals with disabilities and low-income individuals to achieve improved health and greater independence. The programs that support that mission include administration, community-based services, in-home services, the physical disabilities program, and transportation. Aging administration starts on page 380, and as with the other programs, it provides the infrastructure and support for the service delivery components of the aging department, and that's provided by internal staff. The community-based services program serves to help seniors maintain health and community living and to avoid more costly levels of care. Services are eligible to those 60 or over who meet program guidelines. In 2015, there were over 11,000 seniors served through mill levy funded programs. Those included adult daycare, prescription drug assistance, the RSVP program, and legal services. And then 14,000 seniors were also served through grant-funded programs. Some of those services include congregate meals, the caregiver support program, the nursing home assessments that go on, and then information and referral. And then also under community-based services, there are contracts with 18 senior centers throughout the county. And these services are provided by internal staff, and a great deal of them are provided by contracted community partners. The in-home services program also assists seniors in an effort to make sure that they're able to maintain healthy and safe in their home and to delay or prevent nursing home placement. 238 individuals were served. They received case management, home delivered meals, homemaker services, attendant care, and then minor home repair. And the vast majority of those services are provided by contracted community partners. The physical disabilities program is designed to help individuals of all ages who have disabilities remain in the community, maintain their health and independence. There were 677 people who received services through that program, all through community partners. And then the transportation program is the last program in aging. It provides coordination and transportation for seniors, individuals with disabilities, and then to folks in the general rural population. There were 4,300 rides provided through mill levy funding and just over 24,000 rides provided with grant funds. These services are provided both by internal staff and some contracted service providers. Property tax funds for the aging department go to administration, community-based services, in-home services, physical disabilities, and transportation. And then the non-tax funds go to aging administration, community-based services, in-home services, and transportation. Here's the funding request for 2017, $10,773,498, about a 10% increase. The bulk of that increase is tied to the transportation program and a change that the state made where they expanded the consolidated transportation district, and they expanded it from about 4 counties to, I believe, 7 counties, and so it's a little bit larger service area, and so there's some additional funding that came with that larger service area. And then by expenditure, you can see those that increase again hits the contractual area primarily. The housing budget is on page 463 of your book. The housing program was an independent department until 2015, and in 2015 it moved into the Department on Aging, and we were able to realize some efficiencies through that move. But it provides assistance. It's the Housing Choice Voucher, the Section 8 program for the community outside of the city of Wichita. It's a 3-county area. And department staff determine eligibility and administer the program, and they issue housing vouchers that are then spent with landlords in the local community. And the property tax funds for the housing program requests are $34,150. Housing grants are about $1.1 million, and those are those housing choice vouchers. And you can see a significant reduction in the general fund request from 2017 to 16, and that is tied through some efficiencies that we realized by moving that program from being an independent 4-person department into the Department on Aging. And there are your expenditures by fund, or by expenditure. If you'll jump back in your book now to page 399, you've got the Health Department. The Health Department's mission statement is to improve the health of Sedgwick County residents by preventing disease, promoting wellness, and protecting the public from health threats. They do that with a number of different programs, including administration, preventive health, children and family health, health protection, public health performance, and animal control. Like other departments in the division, there's an administrative component, and the health department has a number of different grants. They spend a significant amount of time and effort monitoring and complying with those grants, and that function is provided by internal staff. The preventative health program begins on page 409 in your budget book, and there are a number of different health screenings that are available through the general clinic. Blood testing, lead testing, blood pressure checks. There's also the STI and TB testing that go on. Early Detection Works program is another example of a testing program that's very successful. The immunization clinic is housed in this particular program, along with the lab and the family planning function. In 2015, there were over 3,000 individuals that received family planning services. 757 women and men received services through the Maternal and Child Health Care Coordination Program. Almost 2,500 individuals received services through our Sexually Transmitted Infection Clinic. 522 women received breast and cervical cancer screenings through the Early Detection Works program. Over 19,000 immunizations were provided, and 27,000 lab tests supported all of the work that went on in the general clinic. These services are provided by internal staff. The Children and Family Health Program provides 3 different sub-functions. They're Healthy Babies, the WIC program, and the Children's Dental Clinic. In 2015, there were 1,385 individuals served by the Healthy Babies program. There were 23,000 WIC clients that came to 116,000 WIC encounters. 364 individuals received dental care through the dental clinic. There were 55 screening events. Those primarily happened in schools. There were 12,000 kids that were screened through those 55 dental screening events. They identified 574 dental emergencies that needed to be addressed immediately. And there were 24 different volunteer dentists and oral surgeons that donated time and services to the Children's Dental Clinic, and the value of those services exceeds $100,000 each year. These services are provided by internal staff and then that volunteer crew as well. The health protection program includes epidemiology, the TB control function, and the STI control function. In 2015, we had 3 epidemiologists that investigated over 1,100 reported diseases that resulted in 5,164 encounters, because once that call comes in, they start to connect the dots with the other people that may have been exposed, and that's a significant amount of work for those 3 folks. The TB control program treated 13 people with active TB, and they conducted another 302 investigations related to TB. And the 4 STI control folks investigated almost 2,900 patients and their contacts, and the services are all provided by internal staff. The public health performance program does work related to performance improvement, workforce development, and the community health advocate program. In 2015, they placed 322 students and interns throughout the health department, giving them an exposure to the public health world and making sure that there will continue to be a workforce to do public health. And over 2,100 people received resources and information about low-cost health care in the community. And that work was done primarily by those volunteers in the Community Health Advocate Program. These services are provided both by internal staff and then the volunteer program. And then our animal control program, they enforce Sedgwick County codes in the unincorporated areas, and then they also have contracts to provide service to 11 different cities in the county as well. And they're looking for both the care of the animal and then to make sure that there aren't health or safety risks to Sedgwick County residents. They responded to almost 1,900 service calls. They removed almost 600 deceased animals. They conducted 27 cruelty investigations and then 40 different animal bite investigations. And fortunately, all were negative for rabies. And these services are provided by internal staff. The health department budget request includes a request for property tax funds that support the administration program, preventative health, children and family health, health protection, public health performance, and animal control. And then non-tax funds also support administration, preventative health, significant children and family health funding, health protection, and public health performance. Budget request in 2017 totals $12,141,054, and the increase that you'll see is primarily driven by costs of medications for services that are provided, vaccinations, and some of those other medications that are used. We're hitting the home stretch here. The crime prevention budget is on page 258, and the crime prevention mission is to fund programs in the community that will positively impact the juvenile justice system and hopefully keep kids at the lowest level of interaction with the juvenile justice system and keep them out of the adult detention facility is the long-range goal. This program provides funds to organizations who deliver a variety of evidence-based programs. In 2015, there were 1,500 youth served, 10 different programs delivered by 8 different agencies, and they were monitored quarterly for their performance. And the monitoring takes place by internal staff, and then the services are delivered by those community partners. And that request is the same as last year's, $662,383. And those are all those expenditures are all contracts with service providers in the community. We were asked to bring some efficiency stories, and I have a number of them. One of the most significant, I think, is that EMS bill. We talked a little bit before about EMS billing. As part of the 2013 budget process, I partnered with the Director of Public Safety. He actually approached us and said, is there a way to do this EMS billing more cost effectively? And we discovered that we should be able to save around $300,000 a year by insourcing that billing function. EMS was paying 6%. The first year it cost us right at 3%, and some of that included some one-time costs. And so we're saving about $300,000 a year with this billing function. We're a local provider, so we're much more easy access for providers as well. But that's been a significant savings. It's been a good program. Also in COMCARE, they instituted a walk-in therapy approach for individuals who, for whatever reason, can't seem to make their appointments. The most expensive appointment that any kind of a healthcare provider delivers is the no-show. And by going to a walk-in clinic and not giving appointment times to certain individuals, we reduced our no-show rate by 13%. Revenue went up by about $45,000 in a one-year period. And the consumers that are in that situation get the services that they need, and they don't have to worry about missing that appointment. It seems to work out for everyone. I talked a little bit about the different ways that we deliver crisis services. We do it by telephone. People walk in. Law enforcement brings people into the crisis center. And we've got a mobile unit that goes out. But we've also implemented a televideo screening function. A big part of what the crisis program does is screens people for entrance into a higher level of care, whether it's a local hospital or a state hospital. And by doing those screens over televideo, we were able to save $19,000 in mileage. Staff time gets cut down significantly because we don't have to do the travel to the individual. And we did over 1,100 screens that way last year. Our crisis program, because of the nature of the community, we have to have staff available 24 hours a day. Not all communities have that need to the degree where they can support staffing 24-hour services. And so we've got contracts with a number of other CMHCs to deliver that screen in the middle of the night or in the evening. And so we do televideo screens in 29 different locations across 13 counties, and we generate about $100,000 a year in revenue from those other counties by doing those screens televideo. So we're able to keep the staff here in the community so they're available to our patients, our consumers, but we're also able to leverage those folks in those hours when other CMHCs can't staff. We've also instituted, both in COMCARE and the health department, another technology implementation related to reminder calls, appointment reminders. I imagine all of you, if you've got an appointment with a healthcare provider or maybe your vet or someone else, you're used to getting appointment reminder calls. We used to do that in person. We had staff that made those calls. We've instituted for the COMCARE patients an email or a text or a call to those folks to remind them. And we've seen response rates from those calls go double. So in the past, we'd make a call and we may leave a voicemail message and ask people to call us back if they weren't going to make that appointment. Now, with this system, they get a text that says you have an appointment tomorrow at 10 o'clock. If you're going to make it, push 1. If you're not going to make it, push 2. We've seen a tremendous increase in response. That allows us to do more of those walk-in visits if people indicate that they're not going to make their appointment. We were able to cut staff time that was spent calling significantly, and we've reduced no-shows for appointments as well. We do about 250 reminders a day. 1/3 are text messages, and about 2/3 are recorded phone messages. And we've done a similar, we use the same product for the health department. We make voice calls. We don't do text messages there. But again, we've seen a savings of about 30 minutes a day in staff time making those phone calls, and we've seen very good client feedback on that. Department on Aging has changed the way that they do some of their assessments to the better, and they've started doing all of their assessments based on geographical need. They do cover, for some of their programs, a 3-county area, and so they've used geographical-based scheduling, and they've cut down on time. They've assigned an individual to a particular area, and so that's allowed hospitals and facilities to develop a relationship with that particular employee. So we've got better customer service going on, and we're able to be more efficient because we've cut out a significant amount of travel time that way. And in December of 2013, we had the aging transportation department. Transportation is a huge issue for all of the departments in the division. Getting folks to appointments is very important, and it's a big challenge in this community. Because aging has the expertise that they've developed through their transportation brokerage, we decided to use them to schedule all of the transportation for all of the departments in the division. And they were able to realize some savings in part because they had better contracts with some of the service providers, and we were able to decrease no-shows. In that first year, we saw $3,000 savings, and we made it easier on consumers because we've got folks who may be served by multiple departments in the division, so now there's only one transportation number to call for them. And then I mentioned before how we had moved the housing department, we had moved the housing function from a freestanding housing department into the Department on Aging. We were able to reduce the number of staff involved in that program, and we've seen some positive outcomes from that as well because we were able to increase and kind of bundle some of the outreach activities that aging folks normally do. Now they also go out and talk about housing, and they partner in a way that was different than what was happening before. So we've got some improved communications with consumers as well. And then last, I think this is last, the lead poison screening. Epidemiology and WIC are partnering together in the health department. The Kansas Department of Health and Environment provides the testing kit and the testing for lead. WIC clients are at a particularly high risk for blood lead poisoning, and so we've caught a number of individuals with high lead levels, and we're able to refer them to appropriate additional testing and counseling. But by targeting that program to that particular population, we've seen a significant payback on it. In your Volume 2 notebook, page 155, there is one decision package for the division, and it is around an EMS patient billing representative. When we initiated this program in 2014, we started with 5 staff. As we've seen, Scott's shown us how many increased runs he makes year over year over year. We've gotten to the point where we needed to use almost $31,000 of overtime to fulfill the billing mission for EMS in 2015, and EMS is projecting an increase in runs in 2016 and 2017, 17% increase for 17. And so we would like to add one additional patient billing rep to make sure that we're able to capture all the revenue that the EMS program generates. So in summary, the Division of Health and Human Services budget request for 2017 totals $72,624,028, or 1.2% increase, and there is one decision package in the amount of $59,453. I would be happy to answer any questions you may have.
Well, thank you for the slideshow. It was a lot of information. In less than 45 minutes, we went through about almost 20% of our budget. It was really well organized. A ton of information there. I think can we go back to the very beginning and start completely over again? That was a joke. The reality is this is a lot of information, and I am very impressed with all that we do in these services we provide from Sedgwick County. It's incredibly important stuff. So I know we have some questions and comments. Commissioner Peter John?
Thank you, Mr. Chairman. Slide 55, Tim, can you walk me through again? I noticed a significant increase year over year, both commodities and contractuals. Kind of walk me through what's going on there.
Yes. The bulk of those increases are tied to medication costs, and I've got some examples here. Or Adrian may come up and help me. I know that we've got increased, that particularly in the commodities line item, those are related to increased costs for medications. And Adrian's got some details.
Good morning. And just for immunizations alone, there was a commodities increase for medical supplies and drugs by $68,000. And increase in lab tests under the STI program by $15,000. For a general clinic, increase in $33,000 for drugs. So the drug and medication price really can fluctuate from one year to the next, and so that's why you're going to see that go up. The I just blanked out. The one of the ways to prevent pregnancy, that the injection really can change by hundreds, and so that's just for one person, and so that really can vary. So a good over $100,000 worth of the commodities or for drug and medical increases.
Okay, because kind of looking through this, trying to get a little bit better handle. On the health side, so it's primarily, it's not on the immunizational side of it, Adrian, or is it's
There, some of the increase is in the immunization. There's a $68,000 increase for medical supplies and drugs through immunizations.
okay? Because I know we'd had some questions in terms of how many immunizations to get and what to do, and if we, end up with a number that's different from what we end up using.
And for some of those, we can return and not be charged for them.
Okay. Well, that was a question that jumped out at me in that part of the presentation. Let me jump back to a different area, and Adrian, thank you.
Okay. And it is the Dept that I was thinking about that really can, that's part of the family planning that can vary so much in cost. That also goes up as part of the general clinic, $33,000 for drugs. That Dept goes up and down.
Help me out.
It's a shot that helps with birth control for 6 months versus having to take a.
But you said dental.
No, the Dept.
Okay, I'm sorry. I thought I heard dental at one point and got. Okay. Thank you. Let me jump back on the housing side of things on slide 42, Tim, and I'm going to kind of work backwards forward from the back of your presentation towards the front. One of the questions I had in terms of housing, we're doing that jointly with a couple other counties, correct?
Correct.
Okay, and you'd mentioned a change in terms of number of housing counties, number of counties we're involved in. Maybe I caught it.
That was tied to the transportation, the
On the
consolidated
transportation
transportation district.
Okay.
The housing footprint that we cover is the same as the CPAAA, so it's Butler, Harvey, and Sedgwick.
So that's not changing.
That has not changed.
Okay.
The thing that changed about housing was that it used to be an independent department, and now it's a program within the aging department.
Okay, because I've got some concerns. Do you have any idea if I know there are a number of mandates coming out of Washington in terms of changing programs that are administered by HUD. Do you foresee any significant changes that are going to impact us program-wise as well as budgetarily?
The program that seems to change the least is this housing choice program, the Section 8 program. So I don't anticipate any changes or any impacts, negative impacts, particularly in this area. There has been an emphasis placed on chronic homeless. I've got homeless stuff weaved throughout the division. We're dealing with it in 3 or 4 different places, but there's an emphasis from HUD on programs that serve the chronically homeless, and we've got a couple of programs that do that. The Housing First program, which is not HUD funded, it's locally funded, targets specifically individuals who are meet the definition of chronic homelessness, and then the Shelter Plus Care program, about 10% of those vouchers are targeted specifically for the chronically homeless. And we just saw the release on the homeless point-in-time count from January, and we had a significant drop in the number of chronically homeless individuals, cut almost in half, from in the 60s down to the 30s. And I think part of that is attributed to the attention that HUD has given to communities, and in Sedgwick County it's the continuum of care that's led up by United Way. But the expectation is that more attention be paid to programs for chronically homeless individuals. And so what we're doing now kind of fits with where we were. I'd like to say we were a little bit ahead. We were ahead of where HUD was because we've had this emphasis on chronically homeless individuals since we started the Housing First program in 2007. So we've been doing this and I think making a significant impact in that area.
Well, that's a very positive trend if it's stable and it continues. Let me ask you, one of the concerns I've had obviously on the housing side was if we have any county property tax funds that want to keep Sedgwick County property tax funds in Sedgwick County and having a multi-county program. I know I've focused on this in the past on the housing end. With going to a 7-county transportation program that was mentioned, do we have similar sorts of protections in place? Because I've heard people refer to Sedgwick County as a resource-rich community or county, and
I'm going to let Annette come and describe how that consolidated transit district works.
Okay.
So are you asking about the transit or housing or both?
Well, I'm mainly on the transit side because
Okay.
Because the housing end, and I realize I know that's been in place and it's been stable over time. But if we're changing, and the transportation area is changing a good deal more, so my
Right.
concern is whether we go with, I guess 7 is the operative number of counties in
Yeah,
that.
we were doing for Butler, Harvey, and Sedgwick, so that tends to be our traditional catchment area. Kansas Department of Transportation, who designates the coordinated transit districts, went to a more regional approach, and that was implemented last fiscal year, which would have been July 1st, 2015. So they increased our region to 7, added 4 additional counties. Basically what that consisted of was that funding that they received for their transportation programs for that type of program comes down through the coordinated transit district, which we administer. So that money comes to us and we distribute it out. They continue to do all their own work. They did change the reporting system, so now it's electronic, so it did increase the efficiency of that. So basically the money just flows through us. They do all the work, they do the reporting, they just send the stuff through us. So we continue to get the administrative dollars, but the administrative load really didn't increase that much to cover that new area. So
What are the other 4 counties?
the other 4 counties are Sumner, Cowley, Harper, and Kingman. So the goal of the regionalization was really because the majority of people that are traveling from those communities come to Wichita. They come for medical treatment, they come to the hospital, they come to doctor's office. So the goal was to really increase coordination as they come in from those different areas.
But the state agency driving this was KDOT?
Yes, Kansas Department of Transportation provides the funding for all of those transportation services, and they designate the coordinated transit districts across the state.
Thank you very much, Mr. Chairman.
Commissioner Norton.
I'm going to move up back to Tim.
Tim, okay.
Thanks, Annette. it's gratifying that we've seen the kind of change in chronic homelessness. I was involved in the task force that went for a year, and Housing First came out of that. I mean, that was a model out of Atlanta, Georgia, that we adopted, and it looks like that and Shelter Plus has made a huge difference in the chronic homeless. One thing that's troubling, though, is that the homeless families and children has gone up. And how do we deal with that? Is there anything that needs to change, we need to focus on, we need to think about in the future, Tim, that because that number's going up?
One of the things that we've started to explore is whether or not we've got enough resources in the Housing First program to not only serve. Right now, with the Housing First program, we only serve single individuals, and so we need to think about whether or not there are enough other resources in the community. One of the other things that's happened in this community is that there have been additional VA vouchers come to the community, and so that has helped take some of the load off of Housing First and some of the other community programs, because those additional resources have helped. We all interact with homeless veterans, and so we're able to get them to that particular resource. And so if there's enough resources in the community to address those single populations, then we want to think about how we can potentially expand Housing First to families rather than just individuals. It's a more expensive proposition. We would certainly still focus most of our attention on those chronically homeless individuals, because chronic homelessness usually implies some singularity. It's pretty unusual to find an entire family that's chronic that meets that definition of chronically homeless, but we can find families where the head of household meets that definition. And so we're going to continue to see whether or not we can expand that service program for Housing First.
We currently have 60 units for chronically homeless. Is that correct?
Well, it varies up and down, and we can go as high as about 68 because we've got vacancies throughout the course of the year. We'll get down to 60 sometimes, and we try and keep it around somewhere between 60 and 68.
So we're utilizing most of the capacity all the time.
We are.
So that's because they're housed now, that keeps them off the street. That's why the point of time count went down considerably. Is that correct?
I would think that there's a close correlation there.
The perfect scenario would get that 35 to 38 that are still chronically homeless that we counted into housing. Do we have the capacity, if we can move them into that? Can we get all of them off the streets?
If there were a way to close the front door so that nobody else would become chronically homeless and meet that new definition, it's conceivable, because every year we've got turnover, and we've got 64 to 68 units that are occupied, but we've got turnover every year because the program works. We've got folks who reconnect with family, and they may decide that they're going to, so they reconnect to services, they may get a job, and they may decide that they don't want to use this resource anymore. So we've got folks that are exiting the program positively. We've got occasional negative exits where somebody ends up back in jail, but we've got those exits that happen. If there were a way to keep the front door closed, we just don't know how. I don't think there's a solution yet. How do you keep people from becoming homeless?
Okay. Well, I know it's all about connection to family, connection to service, and then mental health and substance abuse treatment. And if we can get that three-legged stool for each one of them, once we get them housed, then it corrects so much of what's happening with them. Talk about the waiting list for I'm going to shift gears. Talk about the waiting list for CDDO. That's concerning to me, that we still have a lot of people waiting for services. And the whole idea when we changed all of that model was to get services for people. I mean, the state said, we're not going to have waiting lists. We're going to get everybody into services, but that's been just the opposite. And that concerns me in our community, that we've got a lot of folks that are disabled that are still waiting. And that affects families, it affects the economy. I mean, it has ripples throughout our communities.
I'll let Dee talk a little bit about how the waiting list has gone up and down and some of the things that are going on to try and address that.
I don't really know what I can share about it other than It is a concern. That was a goal of the implementation of COMCARE, was that there would be savings and that would be pumped back into the waiting list to take people off. And that has happened somewhat. But we do still have about 1/3 of the statewide waiting list here in Sedgwick County. We've also seen some instability in the data management at the state level. So we have ongoing challenges and working directly with the state staff to make sure that the waiting list stays accurate so that we don't lose anybody due to technology issues. But we still have people coming in. And the reality is, if there's not funding for Medicaid for the waiting list, people have to wait. And the average wait is about 7 years now.
We pretty much manage the program, but don't provide many of the services. That goes to Arrowhead West and Starkey and Ketch. And
we actually now have a network of about 51 community service providers in Sedgwick County that deliver the services directly. We don't do any direct services other than determining eligibility and doing their functional assessment.
Okay.
Everything else is done in the community.
Well, I think that's a concern that we cannot ignore. That it hadn't gotten better. I think we were still leaving some people behind, and I want to be sure that we think about that as we go into budget times in the future. So thank you, Dee. Appreciate it.
You bet.
COMCARE providers have about reached their 3-year agreement, and that's there's rumblings that whole system is going to unravel. Some of them are going to move on. It's going to have to be rebid. That changes a dynamic that scares the bejeebers out of me. If you look at what's happened nationally, where many of those exact same providers have tried to do it in other states, they backed out because they're not making any money. In fact, they're bleeding huge, and that this system that we want to take care of in our community may unravel at the state level. That's just a statement. But I think it's an important statement. Talk about yesterday's decision to diminish the Medicaid reimbursement rates. That has to have a profound ripple effect down to us locally, as people now may not be able, providers may not be able to do what they've done in the past.
It's very early to respond to that announcement, but if you look at if we understand what we've read so far, it does not necessarily, that 4% reduction in payment to providers doesn't flow through to the home and community-based service providers, which would be the providers that serve Dee's network. And so I think it would appear right now, or maybe not, that those folks are protected. There is a protection for some home and community-based service providers. It's unclear what that means. Otherwise, that 4% reduction in the rate to providers for COMCARE could mean as much as $1 million over a year's time in reduced payments received. The impacts on the other programs are going to be less because they do less direct service, and there's going to be an impact on the health department as well because they deliver services. There's going to be an impact on EMS because EMS pays for a number of those, or Medicaid pays for a number of EMS rides, but it's really pretty early to know exactly what's going to happen, but we know that there will be an impact. This happened, I think, in 2010. There was a 6-month reduction in the rate as a budget tool by the state, and that was a 10% reduction, and so that was really significant. It only lasted 6 months. It would appear that this 4% reduction is going to last for the full year. And I also think there will be some probably other reductions in grants potentially to all of the different programs in the division to one degree or another. We don't really know yet. I think the state departments, KDAD and KDHE, are scrambling right now to figure out what that announcement meant as well.
Okay. Finally, for me, and I don't think this is a program we run, but I know it has an effect to the Department of Aging and some others. Talk about Meals on Wheels. What's going on there? Or is that stabilized now?
Annette's going to answer. I believe it is, but she's got.
Okay.
So I think the program you're referencing really is the congregate meal program, because I know you had heard from some of the senior centers. For over 40 years, Red Cross had been the provider in our area for the congregate meal programs. That's where seniors go to senior centers, senior focused housing, other group sites for those meals that are funded by Older Americans Act, which is federal dollars that come to the Area Agency on Aging. So that change was effective October 1 of 2015. So it was a massive change for a program that had been in existence that long to change to a new provider. The provider that we contracted, we put out an RFP. We only had one provider that put in a bid for that service. And they are currently a provider and have been for over 30 years in the region kind of surrounding us down in Arc City and around up through Hutchinson, so a very large area around us, 11 county area. So that transition happened. They did change staff. They changed their delivery routes. They changed a lot of the program, the paperwork, the reservations, and what times they were delivering, and even the meals, although they still have to meet 1/3 of the required daily allowance. So there was a lot of issues in the beginning because of those changes, different staffing, different delivery times, and different requirements from that new provider. For the most part, that has stabilized down. We've got everybody kind of in good working order, and things have settled down.
Does that include our friends in Butler County and that?
I am working with them to solve that. We do have a meeting scheduled May 31st, and we are working to have a Center for Engagement be the facilitator. We felt that was good to have someone from outside step in and help us, so we will have a plan developed, and we're hoping that that will calm that situation in Butler County. Those are really the last two sites that have any concerns.
Okay, sorry to interrupt.
That's all I have, Mr.
I would like to recognize Chris Cronus for an answer.
Back on the subject of Medicaid, you remember the presentation that Rick Durham gave you on the quarterly financial report yesterday. My recollection is that he told you that through the first quarter of the year, Medicaid revenues were down about $1.2 million because of a change in the way Medicare reimburses certain of our programs, primarily in COMCARE. That's just through the first 3 months of the year, that $1.2 million. The $1 million that Tim cited because of the 4% cut that was announced yesterday will be on top of that ongoing reduction that we're currently experiencing because of the change in billing practices.
Well, and that, I did understand that. I just know that every layer of that rolls downhill to us to try to figure out how we give the same services with a lot less revenue. And I don't think we're at the end of this whole Medicaid conversation. I mean, there hadn't been any will to expand Medicaid, so there's been continued delineation of that. So that's all I have, Mr. Chair.
All right, thank you. Commissioner Unruh?
Thank you, Mr. Chair. Just two quick questions. Tim, the decision package, that additional person, it relates directly back to that $300,000 we're saving on the EMS billing? Is that?
It would allow us to continue to save that level. The way the old contract worked with the external provider, they charged 6% of the billed amount, and we staff it at a much different ratio than we do, and we're not taking a cut. And so we would still, I believe, with the increased billing amounts, because we'll collect more because EMS is going to do more service, I think even if we were to add that $59,000 for an additional biller, we'd still be saving in the $300,000 range.
Okay, good. That's what I thought your answer would be. It's kind of a wash. Second question, of the total budget summary here, $72.6 million, how much of that comes from property tax? Do you have that number off the top of your head? I mean, I guess I could go back through and add them up.
About a budget we must have. Ron said, I'm sorry, I didn't have it split out that way. But I'll send it to you. I'd be glad to send it to you.
Yeah. I just kind of, because sometimes when I'm out giving a talk or something, I say, well, it's a big number, but only so much is property tax funds. Right?
I'm sorry, Ron. Can you repeat that, please?
my adding by hand is right, it's 16,399,188 of the 72 was property tax.
16 point.
That's the total spending in property tax supported funds. The property tax revenue, which I think was your question, is less than that. And we'll have to get you that number.
Okay, thank you.
Okay, well, I would like to just go back and visit a couple topics that some of the commissioners have already talked about a little bit. On that CDDO waiting list, can we get some kind of data on that? I'd like to know what it was before COMCARE and how's it changed. I think that I hear mixed reports on whether the numbers. I mean, I'd like to know. I guess it'd be good for us to get the CDDO waiting list data to find out how it's changed since COMCARE was implemented 3 years ago, and where are we right now inside Sedgwick County?
We would be able to pull you Sedgwick County data to the best of our ability. We do track our list locally, but we rely on the state for validation of that list. And we have not been successful in getting consistent reports from the state about the statewide waiting list. So we can do the best that we can based on the data that we maintain locally, but I couldn't give you any idea about how that looks from a state perspective.
That's fine. I would, if you can get the state, that's great. But if not, the county data would be fine as well. And you said there was a 7-year waiting list.
That's on average.
On average. If they have a greater need, I assume that number goes down significantly. Maybe those with less of a need have a longer waiting period. How does that work?
The waiting list is maintained based on their date of requested service or when they anticipate needing the service. They can't go on the waiting list until they anticipate needing the service in the next 3 years. The last waiting list allocations that we received in Sedgwick County, people entered that list in February of 2009. The only way somebody comes off of the waiting list is if the state allocates funds for supporting those HCBS services or if they meet crisis criteria. So if an individual is on the waiting list and they are experiencing a crisis that either puts themselves or others in their immediate network at risk or the community at risk, we can consider making a special request to the state for an exception to that waiting list, and they can pull them off and give them funding immediately. We have about 35 individuals on average a year that come into us through crisis.
Okay, I was wondering. There had to be a way, because I can think of some situations I've been familiar with that are 7 years just wouldn't work. Okay. And thank you for those answers. That's all I need from you right now. Right now on the EMS billing, we've had some discussions about this in the past about trying to collect old debt on that. Has anything ever happened on that yet? We talked about some different ideas.
As a matter of fact, there was an RFP that was released for the collection component of that old debt, and those bids just came in on Tuesday, and we're working with finance and a network of folks to figure out how we want to rate those responses that we've received. So I think that in fairly short order we'll have some information to you about how we're going to go through that process, and then we'll go through and see if we can identify someone that can help pick up some of that, collect some of that old debt.
That's great. Thank you very much. On the slide presentation, on slide number 56, and I think I've asked this question before, but I just need to be reminded. The juvenile crime prevention programs, there's 10 programs with 8 agencies. Can you remind me what those are? Talk about that a little bit more. I mean, the information on the slides is very low.
I would be glad to send you a description of all of the service providers and the programs. I don't have it with me off the top of my head. I know I would leave somebody out. We partner with Boys and Girls Club. We partner with Teoshape. We partner with MHA. I'm going to leave somebody out, but I will.
Along with that, it'd be nice to know how the $662,000 is intended to be distributed amongst those 8 agencies. That's okay.
Absolutely. We'll send you a full report that shows what the program is designed to do, who runs the program, and the funding for it. We're also in an RFP process for those funds as well right now.
Very good. I'm going to just do this question for. I'll pretend I'm Commissioner Ranzoff for just a minute. Slide number 48 on WIC. I'll go look at. I guess it's on page 415. Let me go there real quickly. It's 416, page 416. There was a 10% increase in the budget. Is there this is just administration money, is that correct? I guess I'm getting back to the discussion because I believe, again, what we talked about most recently when we talked about the actual WIC grant was that we accepted an amount enough to completely administer this program and about $100,000 additional. How is this different than what we talked about most recently? There's another. I guess this shows another increase. And so, is this the same discussion or a different discussion?
As we developed the budget, we identified an error that will be corrected in the next version of budget pages that will take that out.
Okay. So just to confirm, we have enough funding in the WIC program to administer the program fully.
Yes, sir.
Okay, that's a great thing to know. And then back to the transportation discussion. I'd like to ask some more questions about that. We had one of the changes that was made, I guess, that started the first part of this year, was we were giving some of the money to Wichita Transit. They were providing some services out to like Mulvane.
That was the newly urbanized transportation funding that came from the city of Wichita. So that is federal dollars that flow through them to provide transportation for their entire MSA. And those surrounding communities were considered newly urbanized. We had been providing that service prior to that time under federal general rule transportation. So because we were already doing the services when the 2010 census data, I think it was to 2000 census data, required them to be under the Wichita Transit as part of the MSA, they went ahead and contracted with us to continue to provide that services. Due to their fiscal issues, they decided, effective the end of December of 2015, that they were no longer going to contract with us to provide the services, and they discontinued providing those services. So that was money that was coming into us from them.
And so that for that funding from Wichita to the Department of Aging here in Sedgwick County, you provided some transportation services out to Mulvane.
What we did, the services we provided were general transportation services, just like the bus. Anybody can use it. However, the majority of people who used it were elderly and disabled coming into medical appointments and some shopping services. But that was for people living in those small communities around Wichita coming into Wichita. Right. So the trips had to originate there and could only come into Wichita. They were not for trips within those communities. They had to come into Wichita for those services. So those all discontinued at the end of December.
Okay, so is that situation right where we left it? Nothing's changed. Those folks right now don't have any solution that's in place to help them out?
There were some of those people that could have qualified for some of our other funding sources. So we had some other funding sources for those individuals that were eligible. We sent letters out to them and said they could apply for those other types of programs. So some of those people were able to access. However, there was a lot of them that were not. And it wasn't like we had additional rides that were available. We were still constrained by the current funding we had. So the ride numbers are still limited, but there were some that would be able to be assisted. The city of Wichita has indicated that perhaps in the future they might again fund those services, but at this point that is not happening.
I'm trying to figure out a way to solve the problem. I guess I'd like to have this discussion, I guess, offline and continue this
Okay.
discussion and figure out a way to help solve this. And I'm trying to think of maybe a volunteer program or recognition program. Maybe we would cover mileage and that type of thing. I don't.
We have three or four new contracts that you have signed that were for volunteer transportation projects in I think it was 4 new communities, and that is using the RSVP volunteers, coordinating those rides through the senior centers, and they are reimbursed for the coordination and maximizing the use of volunteers in those communities. And one of those was at the Mulvane Senior Center. So I think the other
So
one
that may be part of the solution that we're looking for. Maybe the RSVP
that is
program.
one option. Yes. So the potential to expand that.
I'd like to just talk with you more about that later. I think that we need to solve it somehow. And my last question, I think, gets to the senior center funding. I actually lost that I can't even find it in the slideshow. It's so long, I couldn't figure out where it is anymore. So
It's in community-based services.
page slide 32 maybe. Still not sure what it is.
Yes, sir. Slide 32. It is the funding for the senior centers is in that community-based services budget that starts on page 383.
So again, this is one of those things I'm interested in knowing. The total, I guess our budget right now is exactly as it was last year, so the distribution is exactly the same as well. There's no
Yes, it is.
no discussion of any
No
change
change.
there. Okay. All right. That's all my questions. Commissioners, any other questions or comments? I would say, if I had realized how much you were going to bring up this morning, I probably would have done section by section and done questions questions all the way through that, because there's a lot of information there.
If anything that you see in here later on prompts other questions, just let us know, and we'd be glad to get that information to you.
Anyway, I want to say thank you to all your staff. You guys do a great job. The presentation was great, and it is well organized. It's just a lot of information. There's a lot of services coming through Central County, and appreciate all that you do.
Thank you.
All right, we will consider this one done for now. I'd like to recognize Manager Scholes for what's next.
All right, we're in the home stretch. We must spend the next hour and talk to you about the county manager's budget. I'm requesting about $1 billion. No, just joking. All right, somebody didn't tee me up here. I guess I have to do it manual.
You have no decision packages, do you? I don't think so.
I've got about 100 decision packets.
All right.
No, I have 0 decision packets. Commissioners, I'll talk to you real quick about the county manager's budget, and then we'll sum up where we are and for this budget process. First off, mission, which I'm sure everybody in here knows is also your mission, along with the functions of the department. And if you notice on here, we did add the most recent additions of the Public Information's Office and Corporate Communications, the change that we made in just a couple of months ago. That's really where, in terms of the budget, you see that we have the changes that are allocated. Really, it shows an addition here. If you remember, in the BoCC, you voted on a couple of months ago the new PIO. Right now, we have the interim PIO, Kate Flavin. We took a position from the Corrections Department, a senior corrections worker, and lateral over, and that is the position that we made as the PIO. That shows that addition there in the county manager's office. Although it shows an increase here, overall it is a net zero sum, no increase, but we are reflecting it now in our budget. Another thing here, probably of significance, if you notice the ADA budget, it's a negative 89%. What we did with that, as you well know, is the ADA position is outsourced, and that money that is allocated that was in the 2016 budget will now be put into the CIP budget and project list. But all we will reflect for the ADA is the $28,000 for the person who we are using as outsourced to be able to fill that. It's actually an efficiency item for us. But we did have a personnel that actually did this function and had a budget assigned to them for projects, and in this case we outsourced that, and projects will be put into the CIP program. The rest of this, County Manager's Office, you all know. So I'll just really go to the efficiency stories. We talked about earlier the PIO and the corporate communications. Here in a couple of weeks, you'll get in front of you in the staff meeting. The PIO and corporate communications have developed their manual and strategy that will be briefed to you. The consolidation, the reception desk between the manager's office and the counselor's office resulted in a net loss of one position. Sufficiency gained. Change in schedule for the BoCC meetings, creating a little more efficiency there. And also the eliminations of the government relations director position that we now have outsourced by a contractor. Just some of the efficiencies gained. I am sure this time next year when I brief you, I will have a more robust list and a greater list based off of the restructure and redesign that I hope to get in front of you sometime next month and brief you about. But things are looking good in that regard. If you look at my final slide here in the summary, personnel costs, as you see, 7.25% increase. Again, related to PIO position, also my position, in terms of my contract and when I get that next step increase. If I do a good job here in about 5 months and you want to keep me, per my contract, nothing new. But all the rest of that, the negative 100,000 is related to that ADA, taking that money out, and eventually probably put back in the CIP program for some CIP projects. Other than that, not really anything dramatic to report. I hope the workshop has been helpful to you. I'm sure it has, based off of the 5 or 6 pages of questions that I wrote down that you asked. All really good information. If we haven't gotten that information back to you yet, I'm sure we will. But again, kind of summing up what I think you saw is what I saw, is that especially in the public safety arena, in the Tier 1 functions, there's a lot of need. And I think that's where a lot of the priority will be in terms of trying to help them in their request to help fund some core and essential functions, Tier 1 functions that we have, that they have accrued over the last 4 or 5 years that we have really put off trying to fund based off of the budget. There are some Tier 2, Tier 3 type of issues out there that we'll address and try to fund. But overall, what you saw was a flat budget, which was my direction to the staff, is develop a flat budget. The other issue I will help try to solve really is the Tier 1 funding, and 2, the compensation issues that we have across the departments that I think you also saw as a trend that I will attempt to, when I brief my final briefing to you or my final budget to you, will address those 2 particular issues. And with that, any questions and discussions based off of what you saw this morning?
Commissioners, any questions for County Manager's Office? Commissioner Norton.
Just a philosophy and general kind of statement. I'm a real believer that we have a triad of core values, And it is public safety and public works, but it's also public health and human services. And I think it manifested itself some today. We are a big provider of public health and human services in this community. It is critical to the economy and the quality of life of our community, no different than public safety and public works. Infrastructure is important, safety and responding is important, but the things we do in human services is also important. And I don't think we should ever try to diminish one leg of that three-legged stool of public safety, public works, and public health and human services. And if we do, we're not doing our jobs.
Absolutely.
So, just a statement that, you know, we've said we've got to stay with our core values, and I continue to hear that being public safety and public works. But I'm a real believer that we have an obligation to our society here locally to take care of the underserved, because if we don't, they're going to be out on the streets. They're going to cost us more money in the emergency rooms. They're going to create societal problems because of mental health and drug addictions and everything else. So I think we have to be sure that we keep that in top of mind also.
No, you're absolutely right. And in my comments, I did say Tier 1, but there were certainly Tier 2 and Tier 3 items that we needed to address, and we will certainly address those.
Commissioner Peter John.
Well, I would also throw in, and it's a relatively small part of overall county spending, but the idea, and it's, I think, an increasingly quaint notion in our country, but it's a vital idea that needs to be preserved, and if we have to do it at the county level, it's just the rule of law. And to do that, I mean, I've had the opportunity a while back when Bill Meek was heading up the Register of Deeds Association to speak to their group about the fact that we have a lot of folks here at the courthouse with records who are in effect kind of the community umpire or referee. And those documents are vital for commercial, personal, and other transactions. And that's an important part, I think, of what the county provides too. And I realize that may be relatively small. In terms of the human service area, it is one that I think is very challenging in the sense that when we look at a total spending of over $70 million, of which about $16 million is property tax funded and local, we're involved with so many state and federal aspects of it that it's very difficult for us because we're involved in the details of the program, and I think that becomes a real challenge more so going forward, and I think we're absolutely correct in the sense that you know, if we've got people who are what have been referred to as frequent flyers because of whether it's homelessness or mental health problems or alcohol or drug addiction, and it shows up in our jail, you know, whether it's we call it a public safety problem or a human service problem, there's a definite overlap, and that's an ongoing, continuing challenge, and I think having the departments working with one another to do so, and that's why I've been pleased on the judicial side, whether it's drug court or some of the other alternative programs like pretrial services that have played an important role, because when I became a commissioner in 2009, we had days where we had between 1,700 and 1,800 people in the sheriff's custody inside the Sedgwick County Jail, and I think we've come up with a program to keep this community safer from folks who just maybe fall into the human service area more than the criminal area or public safety area. So it's a balance going forward, and I don't know exactly. Kind of view it as maybe trying to ice skate on thin ice while it's covered in banana peels, but it's a challenge and something that I try and keep in mind. And since, Mr. Chairman, you wanted a little discussion, you've got it. Thank you.
Well, I think on County Manager's office we don't have any other questions, so we're done with that part of the hearing. Mr. Manager, I think the next thing on our agenda is just a general discussion of everything we've gone through. This is really wraps up the budget hearings, the process to go through all the budget requests and see what agencies need. But I guess we probably ought to have some discussion about our takeaways and things that we need to maybe work on or things we've still got questions over. So, Commissioners, I would like to ask you for other comments regarding the entire process and anything you'd like to bring up. Commissioner Norton.
Well, just a general comment. It appears to me that the big elephant in the room will be compensation. As we look at the compensation study, as we look at union negotiations with the fire district, the sticking point that we're going to be discussing is compensation. And there's no way to look at that doesn't increase the budget. I mean, unless you're going to lay off a lot of folks to be able to give the folks that are left more money. And we have to be very balanced in that because we don't want to diminish the level of services in any manner. So I think that's going to be the big sticking point as we go through this. I think it'll be the hard nut for the manager to have to inject into his budget as he goes through this. I'm not going to be real warm to diminishing too many services to accommodate raises on the top end. So we're going to have to really balance that, be thoughtful, try to understand it. But as I see it, that's going to be the really hard part of this particular budget this year. We've held off on raises and compensation moves for several years. We've certainly got that happening in the fire district that we're going to have to address, and I think that's going to be one of the hardest parts of this budget as I assess it. So.
All right. Thank you for your comments, Commissioner Norton. Commissioner Peterjohn.
Well, my earlier comments, I'll stand with that, but I'm going to throw out a challenge to the manager and senior staff in the sense that we need to look at overtime because personnel. What struck me is that there seems to be some departments have significant turnover challenges and problems, and other departments don't. And so we get into a compensation package and compensation looking at it as a whole. We also have the challenge that's vivid to me is we have some lower paid positions where the benefits that are being mandated from on high or maybe on low, however we want to view our nation's capital, are providing an extra large burden as part of the compensation. I think of the sheriff's presentation where higher paid people, where the benefits portion was a smaller percentage of their overall salary than the higher. But the challenge I'm going to throw out to the manager and to senior staff is we've got positions where there are people earning significant overtime. And like, for instance, the decision package that Human Services brought together, I don't know to what degree we'd be better off expanding the position, hiring a new person, and then we cut back on overtime, or where the trade-offs and where those decision points are. But that's going to be one of the things that I would look at going forward. Thank you, Mr. Chairman.
Well, thank you, Commissioner Peterjohn. I have the same concerns and questions about overtime. In fact, I like to mention, I guess, that the federal law on the overtime for salaries over 40, what was the number, 47?
47,000.
And change. Okay.
463 or something. 476. 476.
47,700.
$47,476.
$476. And just to remind myself, did you say that was anticipated and some of this is already reflecting that? It's not at all. Do we have any type of analysis on how that's going to impact our?
We are currently working on that, and one of the things that there are a number of different ways to address it, and part of when we look at our compensation options and the way we might make some changes with our compensation plan, there may be some ways that impacts that as well, because we're looking at it as the job grade itself. It's at the job level is a 129 is where that starting pay is at that range for exempt people. So it'd be everyone who's at a 129 and below that are exempt that would be impacted by this. So we're looking at that. We've been going around and talking with the departments to help them understand who this potentially is going to impact, for them to do some analysis for overtime use, and well, not overtime, but hours worked for their exempt people, to see what type of impact that might have for overtime, and looking at making some changes to their workloads. That's one of the options.
And just, again, I probably should know this, but again, when agencies talk about their budget, they're not really budgeting for overtime at all. I mean, overtime is something I think they manage within their own budgets, but we're not seeing the overtime estimates within these budget requests. We are. Based on what they paid out last year and previous years, that's how do they know how much to budget for in the overtime?
It's actually a combination. So they have their normal salaries and wages that position is entitled to based on what they make today. But then we also give them an overtime budget. Because we've been dealing with flat budgets for a long time, it's essentially at what they had been, it's essentially what overtime was that was earned in that department in 2011, adjusted for the pay pools we've had since then. And so they're managing it either with money from vacant positions or from that overtime allocation that they've got.
Okay, so the vacant positions are still funded then?
Right. Unless it's a held position, and we'll get you a list of all of those.
Okay.
Those positions still have dollars in the budget.
Roger, okay. Anyway, it is certainly a concern. And I think nationally, maybe not within our organization, but I think nationally what we're going to see is a transition towards a lot more part-time people that are going to be making much less than $47,000 to try to stay under all the requirements of the government in terms of benefits and overtime requirements. And so, yeah, I think this is certainly going to have an impact on the community. Maybe not as much. Will have a financial impact on us, I have no doubt, but I think we're going to see another impact in the community in terms of unemployment potentially. All right. Well, anyway, Commissioner Norton.
Well, the change in overtime laws withstanding, there's always a balancing act of overtime to hiring new people. If you have to balance, is the overtime worth having an experienced person that can do the job at a certain level, extra hours based on that, and versus paying the benefits and insurance package and vacation and all that. And I know most companies, large companies, wrestle with that consistently. Should we hire an extra person and give them benefits and add them to the staff, or should we, for the time being, the shortfall, just let somebody work overtime? The dilemma we get into is that people work overtime 52 weeks a year, and then you have to worry if you're working them too much, if there's a law of diminishing returns for the hours they work, and are you better off hiring somebody to fill in that and get rid of the overtime? And I know that staff will look at that, try to figure it out. It's all about right-sizing your organization to the right number of people to do the job adequately. And overtime should only be a fallback position, not the general order of the day. So, thanks, Mr. Chair.
Thank you for those comments. And based on some of the data I got recently from Eileen, I mean, there is some positions in some areas in public safety especially where there's a lot of overtime. And I think, at least in a couple of cases, the overtime was as much as their base salary. So I'm not sure what causes that. It's a concern of mine. I know that does drive up their final average salary for the CAPERS calculations right before retirement. If that's what's going on, I don't know. But it is a concern of mine. And I get the idea that some folks want the overtime, and obviously some of them, obviously don't. But some folks are having enormous amounts of overtime. So it's just a concern that I'm not sure how we're managing this in terms of what's good for the county itself. I know some employees want to have control over these things entirely, but I think the employer needs to have control over managing overtime from our perspective as well. Do you have a further comment?
Well, one of the dilemmas you get into is people start expecting that extra salary, and then when you try to wean them off of it, you lose their motivation because they just expect that that's what I'm going to make this next year. And they've adjusted their lifestyle to that, so in many chances you can diminish what they do as an employee. I've seen that before. So that's if you let it get too far out of hand, they start to expect it year after year, and then weaning them off of it becomes a really hard situation. So.
Chairman?
Yes.
One of the issues that the sheriff has had is that exact thing. when we did work with them to do a survey, and one of the things that they heard from their employees is that there were some that would be interested in having 12-hour shifts so they wouldn't have that mandatory overtime. When they looked to try to implement it, there was some pushback from some of the employees who said, oh, I don't want to do that because then I'm going to lose that overtime pay. And so they just implemented it in a few pods, which worked. They reduced the mandatory overtime, they reduced the call-in sick, and they started having much better reduced absenteeism and participation and productivity. And so now they're looking to start moving it into the other pods, the other areas. But they're still getting that pushback from those folks who are going to lose money because they're not going to have overtime.
That's a good point. Commissioner Unruh?
Thank you. Well, I don't have specific comment or recommendation on the compensation issue. I do think it's a big challenge we've got, especially with the sheriff's challenge that he has, and we're going to have to do something to address that. I don't know if some of our department heads, division leaders, can come up with some creative way that perhaps we can contract for services and avoid some of these issues. I don't know if that's a possibility, but we may be able to utilize that in some places. My comment in general is I think that the division leaders and department heads did a good job of trying to come up with flat budgets or nearly that, and so commend you all for that. But there's some challenges that we are not going to be able to escape and avoid, and I would just suggest that although we have a recently self-imposed financial strategy, I would like to see an alternative to the current strategy of cash financing everything and see what the impact would be if we decided to bond finance some of the capital projects and how that might affect us near-term, long-term as an alternative financial management strategy so that we can maintain our level of services and adequately, fairly compensate our employees.
Those are great comments as well. I think the biggest challenge one of the biggest challenges we're going to have is, of course, there's a lot of one-time expenditures being requested out of the decision packages. It's a total of 30 FTE, which is not that much money really by itself, but the $9.9 million reflects, I guess, a lot of equipment that we need. And so majority of the decision packages are not people, but they're things. They're one-time things. And so whether or not we can do all that or any of that this year, I guess we'll have to see what the manager recommends, and we'll probably have a lot of discussion about that going forward, I'm going to guess.
Not everything can be a priority.
I understand that. I think Chris Kernis, I believe, said that earlier. So, all right. Well, I think that's. I don't see any more lights on. There's a lot for us to think about, and really important stuff we've got ahead of us to figure out. And I'm looking forward to continuing the discussion. We've got from now till August what's the date of our adoption? Suppose what's our planned date?
August 10th.
August the 10th. And our first, going back to our calendar, our first public hearing is when?
Wednesday, July 27th at 9 a.m.
All right. All right. Well, thank you so much. I think we'll call it done. We'll adjourn. We're adjourned. Thank you so much.